Hello and welcome to Health Services 411, a program designed to keep you updated, informed, and educated about activities, events, and policies of the BVI Health Services Authority. I'm your host, Marketing and Communications Manager, Natasha Letzam.
Right, so this is the histology department. So what happens that the biopsy comes in a little vial. These are some biopsies for preparing. All right, so once we get that, we open the biopsy, cut it accordingly, and then process it in this machine. Overnight, we process it, and then it goes into wax for cutting, and then it goes onto the slide so that I can see it under the microscope. And these are the stains here that we use to also stain it, to make it visible. So when it is cut, it's white, but the stains now get integrated into the organelles and the nucleus and so on, so that you can see the parts of the cells and the disease process. This is the microtome where the tissue in the wax block goes for cutting. You have to cut it very thin to be able to put it on the slide, and then to be stained and to get it to be viewed under the microscope.
Yes. So when you're doing biopsies, what exactly are you looking for, and how do you determine whether the cell is, cancerous or benign?
Right. There are certain changes in the cell when it's cancerous. For example, the nucleus has a certain size when it's normal. When it's atypical, it has a certain size. When it's cancerous, it has another size. And besides that, the cells themselves change in shape. And depending on the disease process, you can, with experience, you can identify what is the disease process based on how the cells look.
And how long would it take a cancerous cell to affect a healthy cell? Or how long does that process take from, the point of your exposure until, the cell is, cancerous?
Well, some depends on the case. Sometimes it takes 3 years, 5 years. For example, some women, for example, may get exposed to human papillomavirus, and which affects the cervix, and within 5 years they may get cancer of the cervix, because the virus affects the cells and change them and cause them to get cancerous. So it take 5, sometimes depends on the immunity of the person, it may take longer. So it depends on the case. Melanoma is that is cancer of the skin, is one thing that is very virulent. It metastasizes, it travels very quickly. So once you have a melanoma in the skin, for example, you have to get rid of it quickly, because within a few weeks this thing can metastasize and travel in the bloodstream and get to the brain, get to the lungs and different parts of the body. So it depends on the case.
And is there anything that you could do to slow down this process in terms of the metastasizing of the cells? Anything that you could do to slow down that process?
Yes. Once you have to, once you excise the lesion, once you take the lesion out, and the borders are free of any tumor, any lesion, then you will give radiotherapy to the area. Or depending on the case, if it's breast cancer, you give chemotherapy so that any cells that may have traveled that are not detected may get killed in the process. So yes, radiotherapy and chemotherapy help to slow down that process. So this is the morgue area, and this is the freezing compartment with 12 trays. So 12 bodies can be stored there at any one time. Okay.
Has there ever been a point where your capacity was exceeded, and
Oh,
what did you do?
Definitely. During OMA, the capacity was exceedingly. We had to get a trailer with ice to store bodies. There are over 40 bodies during Hurricane Irma. So, we definitely had to get a trailer with ice, a freezing compartment to keep the bodies. That was this was an unprecedented event. It never happened in the BVI, only for the first time, Hurricane Irma. That's when the capacity was exceeded. This is the cooling chamber. Let me just open it so that you can see. So it's sealed. And there is the mortician, he was just here, and he keeps the logbook. And he has the key to the door. And there is a camera watching this place, so nobody could do anything with the body. It's well secured. And inside here is where I do the operation. This is the operation table. This is where the pathologist does the work. The body is here. The head is on that. The back and the hips are here. The foot is here. So we do the cutting and so on and examining of the body right here. We take all the organs, we put it here, put the organs here, and cut them up and examine them properly. So basically, this is the morgue for you.
So after you take the organs out, do you put them back in?
Yes, definitely. We have respect for the body. We treat everybody, it's somebody's mom, somebody's dad, somebody's brother. We put back the organs inside to make sure that they go back to the dust as they came, with everything. We don't keep anything.
Do you know, in terms of, persons who may want to have their organs donated, the kidney or whatever, donated once they have died, is there something that we do here at the BVIHSA in terms of, people dying and, taking the kidney?
No, we don't have that sort of facilities here. We would like that, but we haven't reached the point of kidney transplantation and having the correct reagents and so on to keep that. So we don't do that sort of thing here, and we don't have organ donation here at all. Of course, that is something to look forward to. Eventually with this big hospital we have and nephrologists coming, the capacity to do kidney transplant and heart transplant would increase. So maybe we might be able to do that in the future, in the near future. I look forward to that.
Well, Dr. Redhead, I want to thank you for coming on the program today, sharing with us, some insights through pathology. I was a little scared to come down here, but it's not so bad. And, I definitely enjoyed the tour and, learn a lot about what your department does. And we hope that our viewing audience and our listening audience benefit also. So I leave you this opportunity with final thoughts.
Yes, some people look at the pathologist as some sort of vampire man with a white coat walking down in the basement. But the pathology is much more than that. Besides doing autopsies, we do live things, biopsies, pap smears, body fluids. We help save people. So it's a very exciting thing. And as I said, I do hope that more students could get into pathology so we can have a dynamic society. Yeah. And we would have our own pathologists in the BVI. So I could go back home and rest in peace.
Thank you very much.
You're welcome.
Reporting for the BVI Health Services Authority, I am Marketing and Communications Manager Natasha Letsom. Thank you for tuning in. Thank you for tuning in to this edition of Health Services 411. Please like and share this video and follow us at the pages below as we seek to improve the pulse of the people of the territory. Until next time, remember, your health is your wealth. Reporting for the BVI Health Services Authority, I am Marketing and Communications Manager Natasha Letsa.